Welcome back to CLE Weekend. This time of year, University Hospital's urgent care is a place you need to know about, especially when you see illnesses really starting to increase, and these are popping up all over. So I thought, let's go inside and talk to a doctor about what you can do to help protect yourself. So I'm with Dr. Ginnis, made my way inside, and we have to talk about this being cold and flu season. This is the time of year we really see these illnesses kind of tick up. Let's talk about protecting ourselves and some of the things that we can do.
Sure. Wash your hands, cover your cough and sneeze. If you're really sick, try to stay home, stay away from other people. Things we've been doing this whole time, but more so this time of the season.
As a parent, that's the one thing, you get those email lists that are like, if your kids are sick, do not let them come in. And I know it's like, you kind of struggle with that. But the thing is, you do want to make sure you're protecting them and all the kids and even, adults too. You guys have this really cool thing, spot fire testing. What is this?
Traditionally, what we do is swab you for these illnesses, for the flu, for strep, for COVID. But rather than doing individual testing, this is an instrument that tests for all of those at the same time. So it saves the hassle, you only get one swab, and it's pretty quick. You can find it in real time, and it's a bit more sensitive than the rapid testing that we traditionally did.
Okay, I love that too, because one, it doesn't hurt, it's just very easy and quick. And you find that it's like, oh, my throat hurts. Well, is it gonna be strep? Is it this or that? So you yourself are trying to diagnose when you're like, no, you come in and you guys are able to do that. And like you said, it's in a good amount of time that you're able to do it.
Exactly, it takes under 20 minutes, and again, it saves the hassle of multiple tests. A lot of these illnesses do have similar symptoms, as you mentioned, sore throat, runny nose, so it's hard to tell.
Yeah, what it is. For parents, how reassuring is it for them to know that you can have one test and then you're gonna know, is it strep, flu, RSV, and it's all in one test?
So the younger population tends to struggle with the swabs, as do adults, but it's easier for the kids when we tell them, you only have to open your mouth or swab your nose one time, and they're much happier.
At University Hospital's urgent care, what really sets you guys apart?
Well, we have a lot of physicians and strong advanced practice providers, a wide range of experience, whether it's family medicine, internal medicine, emergency room, so we can see a wide gamut of different illnesses and issues that you come in with.
And you have a lot of locations too, all across Northeast Ohio, which makes it so convenient to come in and see you, especially again, when it's like maybe late at night and you're like, okay, I gotta get in early in the morning to see someone. You don't have to travel very far.
Exactly. We have over 20 locations and growing, all the way from on the west side. We have a lot going from Amherst to Crocker Park and Lakewood, and going down south to the Medina area, and as well far east as Ashtabula along the coast there. So whether it's near your work, near your house, or near a sporting event, we're around the corner.
Let's talk about the difference between urgent care and emergency room, because sometimes it's like, as a parent, again, I keep going back to that because I think these are the situations I've been in most recently. Like, what do you go to?
It can be tough at some points, but if you're having mild symptoms, runny nose, injuries, you can definitely come on in. But if you're having something more severe, chest pain, making sure it's not a heart attack, or really bad abdominal pain, you can't eat or drink anything, sometimes we need other tests that we don't have the capabilities at the urgent care.
And when they do come, you maybe sitting at home to University Hospital's urgent care, the nice thing is you guys have these medical professionals that then stay within University Hospitals, so it makes it very convenient.
Exactly, so a lot of the patients' primary cares are with University Hospitals, so they come to us when they can't get in with their primary, and then they can follow up with them. They have access to all our records and see exactly what we did in the office.
What's one more thing that you hope that people at home would know about coming to urgent care that would be useful for them?
It's very convenient to come in. You can either make an appointment online or walk in, and you'll be seen the same day. And we can see a wide range of illnesses and injuries. We do have x-ray radiology on site, so if you do break a bone or sprain something, we can make sure it's not a break and then you need a cast, and we can do all that on site.
And there is a lot that you guys do and a lot that you do offer. If we want to come out to see you, again, whether it is in an emergency type of situation that you can't get in with your provider, what's the best place to go to find out all of those locations?
Well, we do have a website that lists all our locations, including uhurgentcare.org. but you can always just do a quick internet search of UH Urgent Care near me, and you'll be surprised how close it is to your location.
Yeah, well, when you said it, I thought, oh my gosh, there are a lot. East side, west side again, or even down towards Medina. Thank you so much for chatting with me. And we hope you stay healthy and safe, especially this time of year. But if for some reason you're not feeling so great, you have an option at University Hospital's Urgent Care. Thanks again. We'll be right back on CLE Weekend.